Despite of the significant advances in medicine that we're experiencing these days, medical errors remain a substantial problem in clinical practice. In the United States of America alone, it's estimated between 200 and 400,000 people a year would lose their lives to avoidable medical errors. This is in addition to the uncountable number of patients who would end up with other chronic illnesses or deformities due to these errors. We're all humans and will always make mistakes. However, some errors are difficult to explain or justify, and the best example of which is the error that claimed the life of a 17-year-old girl, Jessica Santonen. And this is her story. Jessica was a 17-year-old girl who was born with a defect of the heart called cardiomyopathy that has caused problems of her lungs. Her blood group was type O, and keep this in mind because this is going to play a crucial role in her story. Jessica was on the waiting list for double heart and lung transplantation at the University Hospital of Duke in North Carolina. Jessica lived through some hard times in her life, and hence the 6th of February 2003 was a very happy day for her and her family, because on that day she received a phone call from the hospital to inform her that they have finally found a suitable donor for her. Unfortunately, little Jessica, her family, or the medical team would know that that day would mark the countdown for her final 16 days on earth. Jessica's short life was full of series of unfortunate events, the last of which ended with her passing away. However, the most tragic and sad events happened years before her death, and this is what I'm going to show towards the end of the video. The events that led eventually to the death of Jessica started on the 6th of February, when the surgeon on call for the organ transplantation at Duke's University Hospital received a phone call from the Carolina Donor Services coordinator to inform that they have a heart suitable for transplantation and they were looking for recipients. At that time, there were no adult patients waiting for transplantation, and hence the phone call was diverted to Dr. James Jergers, who was the head of the pediatric transplantation surgery at the Duke's University Hospital. He was a very experienced surgeon who has done at least 100 operations with success, and he will be an important element in this story. Dr. Jergers informed the coordinator that he indeed has a patient who's waiting for double lung and heart transplantation, and he gave him the name Jessica Santonen and asked the coordinator to check if the organ will be compatible with this patient. The coordinator, after a few hours, came back to Dr. Jergers to discuss Jessica's case, and they discussed a few details including the patient's height, weight, clinical condition, and the functions of her other organs, and they both agreed that the organ would be suitable for this patient. However, the only thing that they did not discuss at that phone call was the very important and very basic and very crucial element in any transplantation, that is the blood group compatibility. In later investigations, Dr. Jergers admitted that he does not recall a discussion about blood group during that phone call, but he assumed that the donor center would have checked all these details, and that's why they approved the process. Next day, Duke's Hospital sent a medical team to the other hospital where the organ is there to examine it and acquire it. And indeed, the surgeon leading that team spoke with Dr. Jergers, and they once again discussed the case, and they agreed that this would be a suitable organ, and hence the organ was taken into Duke's. In the meantime, the hospital asked Jessica to come to the ward in preparation for the surgery, and as soon as the organs arrived on the evening of the 7th of February, Jessica was taken immediately to the theater and the operation started. When the old organs were removed and the new ones were transplanted, Dr. Jergers received a phone call from the immunology lab in the hospital, and they threw a bombshell. The lab informed Dr. Jergers that the blood groups between the organ transplanted and the recipients are incompatible. The organ blood group was type A, while Jessica was type O. Dr. Jergers and his team immediately realized that they're facing a big problem and a catastrophe, because they knew that the immune system in Jessica's body is going to start attacking the transplanted organs, and this is exactly what happened. Jessica was taken to the intensive care unit, and a number of procedures were taken to try to suppress the function of the immune system, including using high dose of immune suppressants. However, Dr. Jergers knew that the only way to save Jessica's life is by removing the incompatible organs and transplant compatible ones. And he indeed started the process of searching for these organs. On the 19th of February, the hospital received another call from the donor center to inform that compatible organs are available. And after discussion with Jessica's family and consultation with the medical team, they all agreed to go ahead with the second operation, which took place on the 20th of February. But unfortunately, by that time, the immune rejection was so bad in Jessica's body that has caused severe damage in her vital organs, and eventually on the 21st of February, she underwent brain death, and the 22nd, she was announced dead. Understandably, following the incident, the hospital hospital in general and Dr. Jaggers in particular underwent a number of investigations and a number of questions were asked. But the most important one of them was how could such a basic and a fundamental test in such surgery was missed. The answer to that is complicated, but the thing that underpins the whole process was assumption. The problem started when Dr. Jaggers assumed that the donor center was aware of the patient's condition and the blood group compatibility. The team that went to acquire the organ assumed that Dr. Jaggers was also aware of this point, and finally when the organs arrived at the hospital and there was an immediate need to rush into the theater, everybody there assumed that the process has been checked and the organs are suitable. Dr. Jaggers admitted his mistake and liability in this case, and following that incident the hospital adopted a new measures to double check every single transplantation throughout the process itself, and since then no such incidents have been reported in that hospital. The sad thing in Jessica's story is how she ended up in Duke's hospital, because Jessica was not American. Jessica came from Mexico 4 years before her death. She was an illegal immigrant who came with her parents from Mexico seeking medical treatment for her condition that the doctors could not treat in Mexico. When they arrived in North Carolina, they lived in a caravan, and their ordeal drew the attention of one of the local residents who started a campaign to raise money towards her medical treatment, and that's when she ended up in Duke's, and that's when she ended up dead.